Antimicrobial resistance, AMR, is finally acknowledged as a major public health threat, currently causing 1.27 million deaths annually and 10 million deaths by 2050 if nothing is done. Low and middle income countries are known to be hit the hardest. The limited access to adequate clinical laboratory support contributes to increasing antibiotic resistance and complicates the management of infections such as sepsis. In the 70 countries where MSF operates, patients are coming to hospitals with bacterial infections not responding to antibiotic treatments. Particular projects show higher rates of resistance. For instance, among war-wounded patients, especially in the Middle East with reconstructive surgery programs for conflict-related injuries, or in CAR and Haiti with acute trauma projects. In sub-Saharan countries, pediatric programs treat an increasing number of children under 5 presenting with sepsis, non-responding to empirical antibiotics treatments. Médecins Sans Frontières, MSF, at the forefront of emergency response in these environments, faces the challenge of adapting its medical response to combat the emergence and spread of antibiotic-resistant bacteria in the populations we assist. To tackle this problem, MSF developed a multidisciplinary AMR strategy built around 3 pillars: the improvement of infection prevention control to reduce MDR transmissions and limit nosocomial infections, the promotion of rational use of antibiotics, and an increase in access to bacteriology diagnostic laboratories. To help facilitate the deployment of AMR diagnostic capacity, MSF has developed 2 innovative projects, MiniLab and Antibiogo. They share one objective: allowing broad access to clinical bacteriology laboratories by providing simplified tools to perform and interpret tests. MiniLab is an all-in-one, quality-assured, standalone and transportable clinical bacteriology laboratory that can be easily deployed and used by non-experts after brief training. It has been designed to be easy and fast to install, responding to the challenges MSF teams face in environments where conventional labs are difficult to install, especially at first level of referral hospitals. The Antibiotic Susceptibility Test (AST) system developed by Beckman Coulter for the MiniLab uses dehydrated microbroth dilution together with an expert system for interpretation developed in partnership with HUNET and provides standardized results across missions where it will be deployed. After several years of validation in referral laboratories and in the field, the MiniLab is now under deployment in several projects across the world. For example, after a 4-week training of technicians in the summer of 2021, the MiniLab implemented in Carnot CAR has started its activities. 7 days per week, the nurses collect blood samples arriving from different hospitals' wards. Their bacteriological analysis supports the hospital's clinicians in their diagnosis of bloodstream infection by identifying the bacteria and providing AST results, therefore improving the patient management and monitoring of antibiotic resistance. Whereas MiniLab is said to be deployed where conventional labs are difficult to install, Antibiogo can be implemented in all existing microbiology labs and labs that cannot be implemented because of a lack of HR. Indeed, through MSF experience in laboratory implementation and assessment, it appears that training the lab technicians to perform the AST can be facilitated with simplified tools and training support as developed by the MiniLab project. But training for interpretation of antibiotic susceptibility testing is much more complex and requires several years. Because of a lack of trained HR, pictures of antibiograms were sent to MSF HQ's medical departments for daily interpretation and validation of results. To overcome these delays, the idea of using an offline, smartphone-based application that could interpret petri dish pictures was raised, and in 2017 the Antibiogo project was born. The Antibiogo team offers a tool based on image processing, artificial intelligence technology, and integrated an existing expert system, improving diagnosis and treatment, which will have a significant impact on the decline of ABR in the long run. The MSF Foundation now has a working application which started the final round of clinical trials last fall at MSF field laboratories in Koutiala, Andaman, and at the Institut Pasteur in Dakar. Main stakeholders of ABR are interested in the app, and the Foundation's ambition is to finalize the development of the first MSF manufactured diagnostic test available for free in all LMIC. Together, these projects work towards creating inclusive access to reliable bacteriology diagnostics, tackling the issue of ABR both directly and indirectly. They will contribute firstly to better patient care by providing accurate and reliable results of bacteriology tests for patient treatments, and indirectly by participating in global surveillance efforts that will support a rational use of antibiotics through the adaptation of empirical treatments.